Welcome to the 87 dentistry, A to Z dentistry. Today we're focusing on the letter P, preventive care. So, what is the background to the story? The why is that one day I went to work and I noticed a lot of children were being put to sleep to have their teeth removed. And I know dental decay is a very preventable disease. And I'm passionate about dental prevention is better than cure. This series is to oral educate everyone, especially families, because I believe knowledge is power. So the background regards children being put to sleep to have their teeth removed. This can be quite distressing for families. So, what are we going to do about it? This topic is very close to my heart, and I would like you to at least go through all the slides and learn something from it. There's so much information to be shared. What are the goals? To understand the importance of preventative dental care, tips for good oral health in families, to understand the CAP model of oral health education. Statistic. According to nature.com, 19,381, yes, I repeat, 19,381 children aged 5 to 9 years were admitted to hospital in 2023 to 2024 due to tooth decay. Do you know tooth decay is a preventable disease? So, one may ask, what causes tooth decay? In simple language, in your mouth, we do have bacteria. So, this bacteria, when you eat food which contains sugar, the bacteria in your mouth acts on the sugar to produce acid, and this acid attacks the tooth, and that's what leads to decay. And do you know that the tooth can repair itself? So if your tooth is decayed, your tooth is one of the hardest substance in the body. When it's decayed, it's brown and soft at times. But when it repairs itself, so for example, if you stop eating sweets, the tooth repairs itself and it may show as black. That is what we call arrested decay. So this is how tooth decay comes about. So your diet plays a very important role in tooth decay. Do you know during the Second World War, because there was rationing of sugar, there was less decay as compared to now. Now, people can just walk to the shop and then buy sweets. I'm not saying you shouldn't have sweets. You can have it, but there's the right time to have it. So, for example, if you eat sweets after meals and you brush your teeth properly with preferably a fluoride toothpaste, your chances of getting decay is much less than someone who doesn't brush at all and who keeps on eating sweets constantly. Because what it means is your mouth is always acid, 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 acid. And that's what attacks the tooth. It makes the tooth very soft and leads to decay. And we all know when you have decay, the complications are pain, risk pain, alternatives do nothing, which is what a lot of people do. Or you can go to the dentist to have it restored. If you ignore it and the decay spreads to the nerve, that's when it becomes very painful and keeps you awake at night. And the only way to resolve it is to have a root canal treatment with specialist or extraction. Losing your teeth is similar to bereavement. That's how bad it is. And if you have the root treatment, there's no guarantee you may not end up having an extraction. Root canal treatment is saying that yes, I know my tooth is bad, but I do not want to have it removed. It's just trying to buy time. So those are the difference. And the benefit is function, of course, and then the pros and cons. Obviously, if you practice dental prevention is better than cure, it's going to save you money because if you lose a tooth, you have to spend a lot of money with replacements and it's not cheap. So it's better to practice prevention is better than cure. And the only way to practice prevention than cure is to brush twice a day with preferably a fluoride toothpaste, spit after brushing, limit sweet to meal times, download NHS Food Scanner app, visit the dentist regularly. If you're a mom who is breastfeeding, as soon as the baby falls asleep, take the breast out of the baby's mouth. And also, if possible, try and cook from scratch. When you cook from scratch, your ability to put in a lot of sugar is less than if it is bought. And the impact of extraction on families. So, if for example, you've got a child who's got loads of decay, and the child is admitted to have those teeth removed that are decayed, it's going to affect you because you will have to take time off work to go and be with the child. It will take some time for the child to recover. And as with everything in life, there's always some side effects. So it's better to practice prevention is better than cure. And it can be quite distressing too because your child is in pain. You have to take time off when all this can be prevented. So you can even use the same toothpaste that the whole family can use the same toothpaste as long as it's got fluoride in it. So what are the benefits of prevention? The benefits are one, you save money on dental treatments, you prevent pain, you're able to have healthy teeth, you're able to have healthy gums, and you have a confident smile. Healthy teeth and gums. So if you're a healthy mouth should not bleed. So you can visit the dentist or hygienist for a clean, professional cleaning and a confident smile. If, for example, you lose a tooth in the front of your mouth, it can affect your confidence. Have you noticed there are some people who hardly smile and may be wondering why don't they smile? It could be they've lost a front tooth and they've lost their confidence or they are scared of going to see the dentist. The earlier you go, the better. So, what are the daily habits? What are some of the things you can do to prevent tooth decay? Brushing. So, if you're going to be using a manual toothbrush, there's a technique to using a manual toothbrush. Please go for a medium bristle. And you have to hold the toothbrush at an angle of 45 degrees. Use the roll technique and move the gum onto the tooth. Please do not brush horizontally. If you brush horizontally, the gums recede and they don't grow back, and it leads to sensitivity. Sensitive teeth is very difficult to treat. If you are not sure, when you visit the dentist or the hygienist, they will demonstrate to you how to brush properly and how to floss. What is NHS Food Scanner app? So this is an app you can download. You can try it now. You can download it now, especially if you are in the UK. So this is an app you can download from Play Store or App Store. It's got a yellow appearance on App Store or Play Store. So what happens is your phone becomes a barcode reader. So you go to the shop, you scan the barcode, and it tells you how much sugar in the food. It's got recipes and it tells you what you can swap it for. So for example, I scanned yogurt. I'm not going to mention the brand. And it told me it's got about 3.5 cubes of sugar. And then I decided to scan a big box of cereal. Again, I'm not going to be mentioning the brand. And this brand of cereal, about 500 grams, which is a big box, had 43.8 cubes of sugar. Yes. And it tells you what you can swap it for. So it's an eye opener. So go ahead and download it now onto your phone and have some fun. And please share on social media how you find it or what you found interesting about it. Another daily habit is brushing twice a day. Some people do not like brushing. Brush twice a day, preferably a fluoride toothpaste, and try and floss. If you've got gaps between your teeth, it's advisable to use TP brushes to do that. It's very, very important. If your gums are bleeding whilst you are brushing, then you can go for hesitant gluconate mouthwash, which is commonly called Cosodol. But it stains at times, so you can use it for a week or two. There's another brand called Keraset, which does not stain. It is the same chlorhexidine gluconate mouthwash, but it's more expensive. You can buy it over the counter. Now we're coming to the importance of diet. If you cook from scratch, you're able to know what you put in inside the food. You are more likely not to put in too much sugar in the food. And so it's very important that whatever we take in can affect our teeth. So if, for example, you're someone who takes a lot of acidic drinks, I will advise you to limit it to meal times and use a straw so it goes to the back of your throat. And if you want to eat any form of sweets, please eat it right after the meals, because we believe after meals you salivate a lot and it washes away the acid. If you keep on eating it constantly throughout the whole day, it means your mouth is being acidic, and that's going to make your teeth get decayed. And if you do not brush, you can still have decay. I'm sharing one of my own recipe with you. This is IG, that is my name, salad. So this is for 2 to 4 people and it can be done under 20 minutes. And I've shared it with you. You can eat it with something else like home baked bread or eat it on its own. So the ingredients are cucumber, lettuce, tomato, onion, a teaspoon of salt, can of sweet corn, can of tin tuna in oil, season all by Schwartz, pinch, a dollop of salad cream. And then I show you the method of how to do it and enjoy it at the end. You can share the recipe. It will be good to know what other recipes you've arrived at. As a result of this recipe, I founded the 10poundchallenges.com, where I challenge families to use £10, go to the shop and prepare a healthy meal for the whole family. Thank you. So, what is the CARB model? The CARB model simply means K stands for knowledge. Knowledge is power. A is attitude and B is behavior. All this forms part of oral health education, especially nowadays it's very difficult to get access. Knowing knowledge will change your attitude to certain things and change your behavior. So please let me know if you've learned something from watching this webinar and you've managed to bring about some changes. Please share on social media what you've learned about yourself and what you've managed to change, what attitude or behavior. Thank you. I'm going to be sharing some tips with you. So it's very important to brush 2 times a day, with preferably fluoride toothpaste, spit after brushing, limit sweet to meal times, visit the dentist regularly, floss if you can. If you got huge gaps, use a TP brush. Register your child with the dentist as soon as they have their first tooth, which is normally around the age of 6 to 7 months old. But in some cases, some children may be delayed or early. So it's very important to register them early and get them used to going to the dentist. I'm very proud to say I've seen a child from baby to adulthood and not even a single decay because they took all that I'm sharing with them seriously. Knowledge is power. What I'm sharing with you is oral health education. So share the knowledge and help others. When breastfeeding a baby, as soon as the baby falls asleep, please remove the breast out of the child's mouth. Breastfeed it. Missing a D. Cook meals from scratch if you can. Download NHS Food Scanner app. Please share the knowledge, since knowledge is power. Oral health education is very, very important. Thank you for watching. Thank you for listening to me, and see you in the next video. Share the knowledge. Thank you for staying till the end. Please subscribe for updates. Thank you for coming, and please stay till the end. We'll be sharing some gems. So today is the 7-day health dental health challenge. Are you ready? I am ready. So as a disclaimer, this information on this channel is for general informational purposes only. We emphasize that dental prevention is better than cure, but it's also important to realize that this is virtual and you need a face-to-face consultation. So what are we going to learn? Today we're going to learn about what to do every day for the next 7 days and why it is important to know about dental prevention is better than cure. I'm sure you are all aware that most people wait until tooth hurts before taking action. Today, I'm going to challenge you on this 7 day to be able to be responsible for your own teeth and also to practice dental prevention is better than cure. So this is a series of challenges every day that you're supposed to do. Are you ready? I am ready. So before we start, I would like you to brush your teeth, use a gauze to wipe your teeth or tissue, and use your own mobile phone to take a selfie of your teeth, of your natural teeth. What do you see? In this, I can see teeth, and the shiny part is the enamel, one of the strongest material in the body. I can see the gum, which is pink. In some people, it's darker, and because of more melanin, so it may be pigment or pigmentation. I can see the upper central incisors and the lower central incisors. The gums look healthy. It's not bleeding. So these are things you can see for yourself by taking a picture of your teeth and then analyzing it and asking yourself, what do I see? Using your own mobile phone. And then the second day, which is day 2, is sugar audit. I want you to take a sheet of paper and write all the sugar that you are having during the day. How many times you are having drink or how many times you have sweets. The best time to eat sweets is after meals, not in between meals. You can have sweets, but it should be in one go. And also, if you are in the UK, you can download the Food Scanner app in App Store or Play Store, and it tells you how much sugar in the food. So the best time to eat sweet is after meals, and use a straw. Do you know that when the bacteria in your mouth feeds on the sugar in the food, it produces acid, and that's the acid that attacks the teeth and leads to tooth decay. 2-minute brushing. You need to brush 2 minutes. I prefer manual. I've got my manual toothbrush here. So you hold the toothbrush at an angle of 45 degrees like this. Do the rule technique applicator, applicator for the rule technique arena. And then brush all the surfaces and brush your tongue for 2 minutes. And now check for ricks. So when you open your mouth, you can see fishes in your mouth. That's those marks on your teeth. So at times it's stained and at times it could be decay, it could be brown or black. At times, if it is black, it means there was a time you used to eat a lot of sweets and now you stop. So the tooth has repaired itself. So it's very important to look out for those stains and teeth just by looking in a mirror. The importance of saliva. Day 5, we're talking about saliva. Saliva is very important. It helps you to speak. It helps you to swallow. It also starts out on food to produce acid. So it's very important. That is why it is important to have sweets after meals, because when you eat sweets after meals, you salivate a lot and it washes away the acid. So saliva is very important. And I've already done a video on the importance of saliva. I'll put the link in the description, or you can check my other videos to see more for more information. Day 6, we flossing our teeth. The lady in the picture is holding a floss stick. For those of you who have difficulties using a proper floss, you can buy a floss stick. This is how to floss. You take a piece of floss, middle finger, roll it round, and you're left with just your thumb and index, and then you come like this, wrap it around the tooth like a C, and then move it up. Don't go like that. So you go like that, wrap the tooth like a C, and then for the back, it's difficult to use both your thumb and middle finger. It's very difficult to use both your thumb and middle finger. So you need to go like this, just using your index finger. Wrap around and clean. So that is how to floss. If you have difficulties, then use the floss stick. Day 7, scan the QR code, which I'm going to do now. So I'm going to scan the QR code. So when you scan the QR code, you use your phone, your mobile phone, to scan the QR code. That's what I'm doing now. And then you see the bit.ly and it says I accept. And then you see dentist AI, US West run up, and then continue to destination. Yeah. And then when you continue to the destination, you come up with this. Yeah. You come up with this. It says take a picture of your upper teeth. So you take a photo of your upper teeth, allow, and then you go like that. So I've taken a picture of my upper teeth, and then it says take a picture of your lower teeth. You do this, and then you click. So I've done that, and then it says analyze teeth. So I just click analyze, which is what I'm doing, and it's going to give me a personal report. So you can also do the same thing. So this is my analysis. So that's the report is given. So it's saying it doesn't show any signs of decay, no significant staining or wear. And lower teeth generally appear healthy with some minor staining descent on the occlusal of the posterior molars. No overt signs of decay. And it also has given me general at-home care suggestions, like I should brush my teeth, floss, limit sugar, use mouthwash, consider drinking fluoridated water, maintain a balanced diet. And then there's a medical disclaimer. This is a screening tool. This is not a diagnostic tool. This is a disclaimer. So you still need to see your dentist for a checkup. This is a screening tool. This is just to help you detect risks of tooth decay in your mouth. So you still need to see your dentist. This is just to help you to monitor your teeth level. So at the end of the scan, you can see the hygienist for hygiene to clean your teeth, and you can see your own dentist for a checkup. If you are in London and you want to come and see me for hygiene and consultation, I'll be happy to see you. I'll be putting the email for you to contact me in my description. So just in case you want hygiene and consultation and a checkup, I'll be happy to see you. Thank you for staying till, and please subscribe for many updates. Thank you. Hello, 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 hello. So this is AI and data prevention. I want you to stay till the end. Very important to stay till the end so that you'll be able to gain a little bit of tips that I'm going to be sharing. So please stay till the end. So today, do you know that there are about 2.5 billion people with permanent teeth that has got to decay? This is quite a big picture of those with a lot of decay. So today is to understand your pain and how knowledge can help and how to practice prevention. So what are the major dental problems in the UK? Please stay till the end since I'll be sharing some gems. So in the world, we have about 2.5 billion people with tooth decay in adulthood. Dental decay is preventable, but that is the total in the world. But I'm going to be focusing on the UK. So the major dental problems we have in the UK are: one, high sugar intake. During the World War II, because people cook from scratch and there was sugar rationing, there was less tooth decay compared to now. And also, nowadays, people don't go to the dentist frequently. They wait till things are very bad before they go. And that is what I'm trying to stress on here, because when you wait till you're in pain, it becomes more costly. And also, some people brush only once a day when it is important to brush twice a day. And also in the UK, if you have tooth decay, you can call 111 to be triaged, and you'll be sent to an urgent dental care center that is close to where you live. And people are not taking responsibility for their own oral health and wait till things get very painful. And cost of treatment, yes, cost of treatment is high. That is why it's important to practice dental prevention, because dental prevention, you save money. And also, tooth decay is increasing, but this can be managed if you take the advice I'm going to give you today seriously. So, what is the solution? The solution is the AI agents I've built with my team. So, an AI agent is able to understand and respond to your inquiries without human intervention. I'm going to share the email of the AI agent with you. All you have to do is brush your teeth, use a piece of gauze to clean your teeth, and then take a picture using your mobile phone of the occlusal surfaces of your upper teeth and your lower teeth. And after you've done it, crop the picture so it's only the teeth that is showing, and then send it to the AI agent, and it will come out with a personalized report. So I'm trying to make you responsible for your own oral health conditions so you are able to monitor. Currently, it is free. So you can be able to monitor whether your things are getting bad or worse. Now, how can you measure that yourself? If you pick a picture of your teeth, you can find out which teeth have got decay. If you see any brown patches or anything like that, or how many missing teeth. Okay, let's keep it simple. If you count how many missing teeth do you have, or how many fillings do you have in your teeth, so that tells you what condition your teeth is in. This is the email of the AI agent that you can send the pictures to. It is main-087650 for Delta number 2 at mystudio-hooks.com. And I'll be sharing some tips with you. Brush twice a day, limit spit after brushing. If you are breastfeeding a baby, after the baby falls asleep, take the breast out of the baby's mouth. AI agent and prevention. Dental prevention is better than cure and saves you a lot of money instead of waiting till things become very painful. So if you are able to take a picture of your teeth and send it to the AI agent and getting a personalized report, it tells you how best you can improve. If you can improve by brushing twice a day, limiting sweet to meal times, and visiting the dentist regularly. I would appreciate your feedback whilst I'm building this AI app as to what will best serve you. So your feedback is very important to me on how best I can improve. Thank you. As always, this is a disclaimer. The AI agent is acting as a screening tool. This video is just to empower you to have healthy teeth, healthy gums, and confident smiles. It is virtual. You need to visit a face-to-face interaction, but this is to help you to become more aware and make choices, better choices for your teeth. Please subscribe and share the knowledge. Thank you for listening and join the movement. Please email main-087650d2 at mystudio-hooks.com. Use small letters. Please email the agent for your own private personalized. Hello, welcome to my channel. Please stay to the end to be able to gain from this. Please stay to the end to be able to gain from this tip. I'm going to demonstrate to you how to brush with a manual toothbrush. If you have a manual toothbrush and you see that the bristles are like this, a little bit splayed, if it's like that, it's bent over, change your toothbrush. Use a medium toothbrush and I'm going to demonstrate to you how to brush. So use a manual toothbrush. Please don't brush like this. If you do that, the gums recede. I'm going to be sharing some very important tips with you. So please, please stay till the end to be able to get all those tips. When you take the toothbrush, there's a technique to brushing. You hold the toothbrush at an angle of 45 degrees like that and do the real technique. Click it up. It's like moving the gums onto your tooth. On the top, you do it like that, flick it down. Please don't go brushing like that. If you do that, your gums recede and become sensitive. Sensitive teeth is very difficult to treat. So, as I said earlier on, if you're using the toothbrush, you have to put some toothpaste on it, okay? So, you put some toothpaste on it. You put some toothpaste on it to brush. And then, as I said, holding the toothbrush should be at an angle of 45 degrees, and then you brush all the surfaces, and then you brush your tongue, brush all the surfaces, but use the roll technique like that, like that, like that, like that. Okay, so you go like this, like this, like that, like that, like that, and clean your tongue. So I'm going to give you a tip now on how to floss. A lot of people find it very difficult to floss. So this is how to floss. So this is the tip. So this is an extra bonus for all those who stayed till the end on how to floss. So this is how to floss. So you take a piece of floss and make sure you take a floss. That is wax, middle finger, your middle finger, roll it round like that. And then you're left to just your thumb and index finger. And then you hold it like this. So you hold it between the teeth and then angle it at an angle of C and then move it up. That is how to floss. For the back teeth, it's very difficult to get your thumb and your index finger. So you go like that, wrap it around, and then slide down. So this is the extra tip I've given to all those who stayed till the end. So till I see you in the next video, thank you for staying till the end. Very much appreciated. Please subscribe for updates and see you in the next video. Bye bye. Hello, 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 hello. Today is World Oral Health Day. Welcome. Today is 29th March 2025. In collaboration with Who Fighters, we celebrate World Oral Health Day. You are welcome to my channel. So today we're going to talk about the importance of prevention. I've always believed in dental prevention is better than cure. It's always important to visit the dentist regularly or the hygienist regularly. Today, the project goals are to understand healthy gums, how knowledge can help, how to practice prevention. Always remember, dental prevention is better than cure. Don't you want to have a healthy gum, healthy teeth, and confident smile? Dental prevention is better than cure, and I'm going to be sharing some tips with you. First one is brushing twice a day with preferably a fluoride toothpaste, spitting after brushing, limiting sweet to meal times, preparing your food from scratch, and also download NHS Food Scanner app. It is an app that when you go shopping, you can scan the barcode on the food and it tells you how much sugar. I scanned yogurt, a type of yogurt. I'm not going to mention the brand, and it came up with 3 cubes of sugar. And then I scanned a big box of cornflakes and a very big box of cereal. And the sugar level was about 40 cubes of sugar. So there are different types of cereals. But again, I'm not going to mention the brand. So it is very important to limit sweet to meal times. I never say do not eat sweet because it's not realistic. You can have sweets, but please have it after meal times and use a straw when you have fizzy drinks or juices so that it goes straight to the back of your throat because the acid can wear at your teeth. So it's very, very important to use a straw. I've always believed in dental prevention is better than cure. Today is World Oral Health Day. We need to get this knowledge out there. For nursing mothers, when the child falls asleep, please remove the breast out of the child's mouth. Don't let them go to sleep with a feeding bottle in their mouth or the breast in their mouth. As soon as they fall asleep, please take it out. And always remember, this channel is for educational purposes, and you still have to visit your own dentist for a face-to-face consultation and to find out which treatment suits you. This video is just for educational purposes and to educate you and to share the knowledge. Please share the knowledge. Very, very important on this World Oral Health Day. It is important to visit the dentist and hygienist regularly. And also, as soon as the child have their first set of teeth, you need to register them with the dentist. So these are the tips again. In summary, brush twice a day with preferably fluoride toothpaste. Limit sweet to meal times. Spit after brushing. Download the NHS Food Scanner app. And the results is a healthy gum, healthy teeth, and a confident smile. Share the knowledge and subscribe to the channel. Thank you and see you in the next video. Thank you for being with me to the end. World Oral Health Day. Always practice prevention is better than cure. Thank you for listening. Thank you. Hello, 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 hello. I'm excited to be here. I've just started a new series, and this series is called A to Z of Dentistry. Access. So we're starting with the letter A. So that is access. My name is Dentist I Fortune. I'm so pleased you are here today. Thank you for listening. So what do you need to know? So the background to this is that people are trying to look for dentists, whether there is any availability. So I'll talk about London. In London, if you need a dentist, you either go to your own dentist, which is an NHS dentist, or a private one. If not, if you cannot book an appointment with your own dentist, then call 111. 111 would triage you according to where you live. They'll be able they'll be able to give you an appointment and you'll be seen in an urgent care setting. But you still need to go out there to your own dentist. It's an emergency service. What are the goals of this webinar? It's for you to understand dental access, how knowledge can help, how to access dental care. So the discussion is going to be around what is access to dental care. That is, if, for example, you have tooth decay and you want a dentist, how do you find one? You can either go to your own NHS dentist or a private dentist, or which area you are, you can call 111 and they will triage you. And access to dental care. So there are urgent care hubs where you can go for urgent care treatment. And it all depends on the call that you make, which is the 111 call. Or you can decide to go to your own dentist for emergency. How to access dental care, I've already said it already. So if you are an NHS patient, you go to your own dentist. If you have got a private dentist, you go to your own private dentist. Or you can access knowledge on YouTube with trusted clinicians. For example, a practicing dental surgeon, a practicing clinician. So they've got a lot of YouTube videos out there for you to learn a lot. So when you go to those videos, they've got knowledge. It's just very important to know that the person you are getting the knowledge from is trained and qualified. Or on the other hand, as I said earlier on, you can call 111. Accessibility and availability. So what is available to you? Every area is different and how to access it. The first point of call, if you can't get access to your own dentist, is to go online. But make sure the information you are getting is from a trusted clinician. And the result is dental prevention is better than cure. That is why I'm doing this video to help you. I'm starting the A to Z dentistry series. And the first thing I'm covering is access to dental care. So if there's any knowledge you need to take from this webinar, is that you can access knowledge to advise yourself, do it yourself by going on YouTube, but look out for trusted clinicians. There are now clinicians online who are giving free advice. And then the other option is to book an appointment with your own dentist. Or depending on where you live, you can call 111 and they will direct you to an urgent care center. They will give you an appointment for you to go there for your urgent care treatment. However, you always need to go back to your own dentist for maintenance. Conclusion, share the knowledge, like the webinar, comment on it, and see you in the next video. Thank you for listening. Thank you very much. Thank you for listening. I'm very grateful that you stayed to the end of this webinar. I can't wait for you to see the rest of the A to Z series. Thank you for staying. Thank you. Hello, hello. Today, we're talking about A to Z dentistry. Today, we are focusing on the letter F for F for facial sealants. So one may ask, what is a facial sealant? Facial sealant, according to the gov.uk, it is a form of preventative material to control dental decay. So we're going to talk about it. The goals are, what is facial sealant? How knowledge can help? Dental prevention is better than cure. So the procedure, a facial sealant is like a coating. So when you look at your tooth in the mouth, it's got grooves. So a facial sealant is like a coating over the grooves. I'm going to keep it simple, and it prevents food from getting stuck, leading to decay. So it makes it shallow. So as you can see in the picture, and the procedure involves you going to the dentist isolating the tooth, using some materials and using a special light to cure it. And so after you finish, you end up with a shallow groove instead of the normal groove in the pit. So a fishing sealant is a form of preventative material that is to prevent the cavities from being deep. And if you have a denture, some people have dentures anyway, but if you don't take good care of your teeth, then one day you're going to end up wearing a denture. That is why it is important to start with preventative filling if you have a cavity. This is an educational video, so if there is anything, it's best to visit your own dentist regularly because everybody is different. Analysis. So there's a difference between a pit and fissure. So if you look at a natural tooth that has just come through, you can see a pit. That's a point where when you put a probe, it goes in. And a fissure is like the design on the top of the tooth. So the result is you are trying to practice dental prevention is better than cure. So in simple language, a precious sealant is like a preventative coating to prevent dental decay. So instead of having pits and fissures that allow food to stay in and leading to decay, you sort of clean it and then seal it. Put a sealant on top of it as a form of preventative decay. So you are doing a filling before having any decay, especially if you are prone to eating a lot of sweets. So the conclusion is share this knowledge and thank you for listening and thank you for staying to the end. I'm very grateful. Thank you very much. Thank you. So thank you. Thank you very much. See you in the next video. So, what are the learning outcomes? Understanding the importance of dental health, knowledge of dental prevention, sharing some tips, and promotion of digital health in the community. Significance of a confident smile. The lady is smiling, she's happy. What does confident smile mean to you? What is your definition of a confident smile? Confident smile is what is in this picture. The lady smiling and being very happy. This tells you how important your teeth is. So what led to this webinar? So what is the why? So one day I went to work and I noticed a lot of children were being put to sleep to have their teeth removed. According to www.gov.uk, about 47,000 children between the ages of 0 to 19 had their teeth removed due to teeth decay, and this cost the health service about £40 million. This is what motivated me to do this presentation, to educate, sharing knowledge. I believe in the CAP model of knowledge, attitude, and behavior. And this is a statistic, and this from The Guardian. And it says number of children having rotten teeth extracted in hospitals and due to tooth decay costs the health service £40.7 million. And this is a statistic which was published on the 8th of February 2024. The picture you see is an arrested decay. So when you eat a lot of sweet, your teeth become soft and brown. But when the tooth repairs itself, it shows as black. One may ask, what causes tooth decay? Tooth decay occurs when bacteria in your mouth feeds on the sugar in the food to produce acid. This acid attacks the teeth, and that's what leads to teeth decay. In this webinar, we will cover ground rules, about me, what I have done, dental prevention and tips, and questions and answers. Now, for the purposes of this presentation, if you have any questions, please put it in the comments. About me, I'm an innovative dental surgeon. I'm a mentor. I'm a poet. I'm a teacher. I'm the author of 3 books. My philosophy of life is to make a difference which becomes a ripple effect to inspire the next generation. Here's what I've done in the past. The first book I wrote was Positive Work-Life Balance. The second book I wrote was Mommy, What is Tooth Decay? Prevention is better than cure. This has recently become a #1 bestseller. So you could go to Amazon and get a copy. And the last book I wrote was Book of Poetry, Why I Create. I love poetry. This is some of the things I've done in the past. Being a King's alumni, I went to Guys to plant some flowers as part of King's Global Day of Service. I have volunteered at TEDx London. I love voluntary work. And I was also part of this TEDx NHS. And this is the launch party. This is what I've done in the past. I took part in artificial intelligence versus corona hackathon during the lockdown with data scientists, and our team won the first prize. I'm not what I have done, I'm what I have overcome. Other things I've done is being part of this team, the research we did over online, which was great. I also took part in Clinician Burnout Conference. Now we're going to talk about the teeth. There are 2 sets of teeth in your lifetime, your baby teeth and your adult teeth. Your baby teeth, after your teeth have fallen out, you are left with only your adult teeth for the rest of your life. If you take good care of your adult teeth, it will take very good care of you. Teeth is very important for speech, eating, and feeling very confident about yourselves. So take good care of it. Nursing caries. So what is nursing caries? So this happens if, for example, a mom is breastfeeding the baby and the baby falls asleep. As soon as the baby falls asleep, please take the breast out of the mouth. If you leave your breast in the mouth, because the child is asleep and there's no washing of the bacteria with the saliva and the milk, it eats the teeth and leads to decay. That's what is nursing caries. So nursing caries is dental decay as a result of leaving the breast in the mouth. What is gum disease? Gum disease, a healthy mouth should not bleed. Therefore, if you see blood in your mouth, that's the first stages of gum disease. Gingivitis is the inflammation of the gums. Periodontitis is when there's a breakdown in the bone. I always tell my patients the gums are like the foundation of a building, and you need to take very good care of them. Losing your teeth is like bereavements. So the first stages of gum disease is gingivitis. If you ignore it, periodontitis. And there are some risk factors. So if you smoke, your gums bleed more. If you are pregnant, because of the hormones, your gums will bleed more. If you are diabetic, because of poor wound healing, your gums will bleed more, and you need to see the hygienist regularly. Risk factors: smoking, pregnancy, diabetes, as I said, and you can prevent it by regular hygiene instead of ignoring it. These are the prices of NHS and private. So NHS prices, in order for things to be very simple, they've come up with this. So band 1 is a checkup, which is 2680. This is 2024 prices. Every year the prices keep on changing. Band 2 is a filling. For example, a silver amalgam filling is 73.50. Band 3 is anything that involves a lab work, like a soft bite guard or a denture or a crown, is 319.10. So this is NHS prices. If it's an emergency, it's 2680. Now, one may ask, who are those who are entitled to free dental care? If you're on universal credit, tax credit exemption, if you've got an AC2 certificate or AC3 certificate. AC3 certificate, it means you pay something towards the total and the government pays the rest for you. If you're under 18, if you're pregnant, if you're on income support, if you're on income-related employment support allowance, if you're on income-based job seekers allowance, and if you're on pension credit. There are two types of pension. So please check you're on the right pension. It is pension credit, or else you will be asked to pay a penalty if you're not entitled to it. For private treatment, it depends on the practice. The practice sets their own fees. So burnout. So what is burnout? There's a difference between negative work-life balance and positive work-life balance. Do you know the difference between positive work-life balance and negative work-life balance? If there's a negative work-life balance, you end up with burnout. Now, you will never see a matchstick the same way. This is an analogy. Which matchstick are you? Are you at the beginning of your burnout, in the middle, or have you worked yourself to ashes? Work-life balance. A lot of staff do not have that sort of work-life balance. They are working, and even on holidays, they are still working. And they need to have that sort of fine balance between their work and their home life. So what does work-life balance mean to you? You're the only one who can answer this question. And the only way to analyze it is to take a big piece of paper, draw a circle, divide it into segments. Every segment should represent an aspect of your life. For example, your working life environment, your home, your life, your finance, your um, romance, anything that means a lot to you, and give it a score of 0 to 10. On the outer is a 10, towards the center is a 0. So give it a score out of 10, and after that, join the dots. Does it look balanced to you? If it doesn't look balanced, you are the one to do something about it. The next is stress, immunity, burnout, and racism. Some people, when they are stressed or they feel run down, they end up with ulcers in their mouth. And this ulcers clear up within 2 weeks. If you have an ulcer in your mouth, which has not cleared up in 2 weeks, and you smoke or drink, please seek specialist advice. If you grind your teeth at night, the medical term for grinding your teeth at night is bruxism. And at times, having a negative work-life balance or being burnout can make you grind your teeth. Therefore, you need to find out the cause of what is stressing you up and try and do something about it. But as a dentist, we can help you. We can provide you with a self-bite guard, which you can wear at night to prevent grinding. You can do some gentle jaw exercises. For example, curling your tongue to the roof of your mouth to prevent grinding. Tooth erosion, acid, bulimia, hard toothbrush. So if you brush really hard, it sort of leaves marks on your teeth. It leads to gum recession. It makes your teeth very, very sensitive. And that's why it's important if you're having anything acidic, like pure orange juice or lemon juice, use a straw so it goes to the back of your tooth. Some people suffer from acid reflux and it can affect their teeth. It makes their teeth sensitive. You can use Sensodyne toothpaste, which you can buy for the chemist, or you can buy sodium fluoride mouthwash, which is called Fluorogard by Colgate. Also, you can go to the dentist for a prescription for sodium fluoride toothpaste, 5,000 parts per million, which you can rub over the surface. You can have fillings, you can have crowns, but every person is different. Anything that I share here, there's a disclaimer. You need to see specialist advice. You need someone to examine you. This is just knowledge that I'm sharing to help you. Halitosis, bad breath. What causes bad breath? Poor oral hygiene, having tooth decay that you haven't restored, eating too fast, and also certain food. When, for example, I may eat garlic and I may not have bad breath. Someone may eat the same thing and end up with bad breath. You need to write a list of the medication or things that you are taking that gives you bad breath and avoid them. Try and visit the hygienist. Try and have hygiene treatment. Try and eat slowly. Brush your tongue, floss, and you can use a mouthwash called Retardis. You can buy it from the chemist and see the hygienist or dentist to find out the cause. Orthodontics, tooth crowding, or crooked teeth. The lady has got a gap between her teeth. She's smiling, she's happy. It's called a diastema. In some parts of the world, it's beauty. If you've got a gap between, it's beauty. Some people want to close it. If you want to close it, you can go to the orthodontist. If your teeth are crooked, you can see the orthodontist and they can straighten it for you. But it's quite costly. Importance of dental prevention, because dental prevention is something that we are very passionate about. You want to have healthy teeth, healthy gums, and confident smiles. So how to brush? Do you use a manual or electric? If you are using a manual toothbrush, there is a technique to brushing. You need to hold the bristles at an angle of 45 degrees between the gum and the tooth and use the rule technique, moving the gum onto the tooth instead of horizontal action. If you use horizontal action, the gum recede and they become very sensitive. If you think you are heavy-handed, then please use electric toothbrush, especially the ones that flash. It's got a light on it. Dental tips and importance of dental prevention. So these are some tips I would like to share with you. Number one, brush twice a day with preferably a fluoride toothpaste. Spit after brushing. Limit sweet to meal times. I never tell people not to eat sweets. It's not realistic. You can have them, but it should be after food, because after eating you salivate a lot and it's able to wash away the acid. So it's better to have it after meals instead of constant snacking. When you snack all the time, it means your mouth is being bathed in acid, acid, acid. And also, if you've got a smartphone, download the NHS Food Scanner app so that your phone becomes a barcode reader. So you can scan anything, any cereal or anything that you have in your cupboard, the barcode, and it will tell you the number of cubes of sugar in it. If you remember, during the Second World War, because of rationing of sugar, there was less decay as compared to modern times. It's good to cook from scratch if you can, because when you cook from scratch, you know how much sugar you're putting into your food. Nursing carries. So if you're a nursing mother, please, 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 when the baby falls asleep, take the breast out of your mouth, out of the mouth of the baby. Conclusion. So regular visit to the hygienist and dentist is very important. Register the babies as soon as your child cuts their first tooth. It normally comes around age 6. Some kids are late, others are early. So do not worry. As soon as you see teeth, start cleaning it and then register with the dentist. Remember, a confident smile starts with a good oral hygiene. And always remember, prevention is better than cure. If you have any questions and answers or any questions for me, please put it in the comments and I'll respond to it. Thank you for being patient with me. Thank you for listening and see you in my next video. Thank you.